You know that feeling, right? Your stomach is doing flips, your mind is just racing, trying to rehearse every single thing you might say, and you're just convinced, deep down, that something is about to go terribly, terribly wrong. It's a feeling we all get sometimes, but for a lot of people, this isn't just a little case of nerves. It's a constant, powerful force in their lives. Welcome to The Explainer. Today, we're going to break down two really common and often connected anxiety conditions: generalized anxiety and social anxiety. We're going to look at what they are, how they can pull you into the cycle of fear, and, most importantly, the proven ways to get out. So here's the plan. First, we'll define what we're actually talking about. Then, we'll get into the mechanics of that anxiety trap. After that, we'll dive into the treatments that actually work. And finally, we'll reframe what getting better truly looks like. Okay, let's get into it. Before you can tackle something, you have to know what it is. So what really is the difference between that constant nagging worry that seems to float around and that super focused, intense fear? So first up, we have generalized anxiety disorder. You'll hear it called GAD. Now, the key words to lock onto here are excessive and uncontrollable. This isn't just, being nervous about a big meeting at work. This is a worry that's kind of chronic, and it can attach itself to almost anything. Your job, your health, your family, you name it. And it's there more days than it's not. And then, on the other hand, we have social phobia, which today we usually call social anxiety disorder. This is a whole different beast. The fear here is laser focused. It's all about the fear of being judged, of being watched, of being humiliated when you're around other people. The anxiety isn't about everything. It's about you and how you think you're coming across. This is such a great way to picture the difference. Think of GAD's worry as free-floating. It's like this general cloud of anxiety that just drifts around and can settle on any part of your life. But social anxiety, that fear is like a spotlight, a hot, intense spotlight that's aimed directly at you the second you're in a social situation. It's all about your performance and that fear of being judged negatively. But here's something that's absolutely crucial to understand. For a lot of people, it's not one or the other. It's very, very common to have both. And you can imagine how that gets complicated, right? The general free-floating worry from GAD can easily fuel the specific fears of social anxiety, and those social fears can make your overall anxiety even worse. They kind of feed each other. So how does all of this build up into something that feels, well, like an inescapable trap? That brings us right to our next section, the anxiety trap. Because if you can understand how the trap works, you can start to figure out how to dismantle it. Okay, this right here, this is the engine that keeps anxiety running. It's a vicious cycle. Let's walk through it. It starts with a trigger, right? Say you get an invitation to a party. Immediately that sparks a negative thought. Oh no, I'm going to say something dumb and everyone's going to think I'm an idiot. That thought triggers a real physical anxiety response. Your heart races, you start sweating. So what do? You use a safety behavior. Maybe you just don't go, or you go but you spend the whole night staring at your phone in the corner. And here's the kicker, the final step that locks the whole thing in place. You leave thinking, phew, I survived. It's only because I stayed quiet that nothing bad happened. And just like that, you've reinforced the belief that the party was dangerous, making the whole cycle even stronger for next time. And this quote, wow. It gives you such a chilling peek inside what's actually happening in that moment. It's not just thoughts, it's pictures. People with social anxiety literally see a movie in their head of themselves from an outside perspective. But here's the thing, it's not an accurate movie. They're not seeing what other people see. They're seeing their own fears projected onto their image. They're watching a horror film starring themselves, directed by their anxiety. And this is the paradox, the really cruel twist in all this. Those safety behaviors, the things you do that feel like they're saving you, they're actually the bars of the cage. By avoiding the party, or by staying silent, you never, ever get the chance to find out that your fear is unrealistic. You never get the evidence that you could, in fact, go to the party, say something a little awkward, and the world wouldn't end. People would just move on. So if that's the trap, how in the world do you get out? Well, the really good news is that there are very well-researched, evidence-based treatments that are incredibly good at breaking this exact cycle. The two main pathways, the heavy hitters, are cognitive behavioral therapy, or CBT,
and pharmacotherapy, which is just a fancy word for medication, and they often work best together. You can think of it like this: the therapy gives you the skills, and the medication can help turn down the volume on the anxiety so you can actually use those skills.
So let's talk about CBT first. This isn't about lying on a couch and just talking about your feelings for years. It's active, it's practical, it's focused on the here and now. The whole goal is to give you a brand new toolkit, a set of skills to systematically take apart the thoughts and the behaviors that are keeping that anxiety cycle going. CBT really attacks the problem from two sides. On one side, you have cognitive restructuring. That's where you learn to be a detective for your own thoughts. You catch those automatic negative thoughts and you put them on trial. You look at the actual evidence. Then on the other side, you have behavioral experiments, or exposure. This is where you slowly, safely, and systematically start facing the things you're afraid of, not to torture yourself, but to run an experiment, to actually test if those catastrophic things you're predicting will happen. But let's be real. Trying to do that hard work in therapy can feel impossible when you're already just drowning in anxiety. And that's where pharmacotherapy can be an absolute game changer. It doesn't magically make the problem go away, but it can lower the intensity of the physical symptoms, that racing heart, that panic, so that doing the work in CBT feels manageable, not overwhelming. So looking at the types of medication, for years, the first choice for many doctors has been the SSRIs. They work on a brain chemical called serotonin, which is a big player in mood. They're super popular because they're generally just as effective as some of the older drugs, like MAOIs, but they tend to have fewer tricky side effects. And this research quote really explains why the type of drug matters so much. It's all about how well they work on serotonin. The ones that are potent, the ones that are really good at increasing the available serotonin, are the ones that studies consistently show actually work. The weaker ones? Not so much. That specific action on serotonin is the key. And the results really speak for themselves. We see in studies on similar conditions that for patients who are new to treatment, about 70%, that's 7 out of 10 people, get at least moderate improvement from these serotonin-focused medications. That's a huge deal. It's a powerful tool to have. And this all brings us to our final, and maybe our most important section. We've talked about the problem, we've talked about the tools, but what's the actual goal here? What does getting better even mean? Okay, this right here might be the single most important thing to take away from all this. Recovery is not, and I'll say it again, it is not about completely getting rid of anxiety. Anxiety is a normal human emotion. It's part of our wiring. The goal isn't to become some kind of fearless robot. Instead, the goal is to reduce the disabling impact of the disorder. It's about shrinking it down. It's about getting to a point where anxiety might show up sometimes, but it's just a feeling in the passenger seat. It's not the one driving the car, telling you where you can and can't go. So ultimately, that's what effective treatment gives you. It gives you a toolkit, and it gives you a choice. It gives you the skills to look at that whole vicious cycle and see it for what it is, just an old, worn-out pattern, and the power to say, you know what? I'm going to choose a different path this time. So we'll leave you with this to think about. What if the real victory isn't about fighting anxiety to the death and trying to silence it forever? What if it's actually about learning to listen to what that feeling is trying to tell you? And then, with a whole new set of skills and confidence, choosing for yourself
how you want to respond.